if you want to really create something big and not just to create something that will last not for a long time. Surround yourself by people that know how to look at the market with a fresh eye and to have truly innovative ideas. So that would be my advice.
In today's episode on the MedTech 101 podcast, I have a really exciting company based in Paris, France. And I know most people might know Paris from, the romantic movies we've seen, but Paris happens to be coming up with a lot of technology. And today's company, AZMed, is the first French company to get a CE mark for like an AI software in radiology, which I think is quite fascinating. And I'm honored to have the CEO on the podcast today, Julien Vidal, with me here. So yeah, welcome to the podcast, Julien.
Thank you, Rodney, and thank you for having me. It's a real pleasure to exchange with you today.
Thank you very much. I'm honored to have you here today. Whilst I was doing some research on you, I saw that you got a business background, and I even watched a video on YouTube when you were doing a pitch like 5 years ago for something called
It was a long time ago.
Paris. Yes, and it was like 6 minutes, and I was like, I watched it all, and in 6 minutes, I managed to get an idea of what you guys wanted to do. But just looking at that, moving from your business background, doing that pitch, which is really good, and other videos you've done a lot, and to this point where you now sort of the CEO of AZMed, which is a software company essentially, but to be more specific than that, it's a software that helps radiologists sort of see or read x-ray scans, because you'd be surprised by how many mistakes people can make when reading an x-ray. So yeah, do you just want to give us a background on how you went from business to running a software company for healthcare?
Yeah, I don't know how much time you have, but I can tell you the story. First of all, thank you for having me. Really, I told you before we started. I think it's a great initiative that you have, and it might sound like normal or like natural to you, but I can assure you it's not. I mean, we sell our AI solutions now in more than 40 countries and in all the 5 continents, and it's still like a huge part of our process to educate and to explain what we do with AI. So every time we see initiatives to learn about innovation in the medical field, we find it very useful. So thank you for that, really. So yeah, I'm glad to share my journey with you, and most importantly, AZMed journey. So I'm Julien. I was born in France, as you said, in the beautiful city of Paris, and I completed all of my studies there. And after high school, one of I think the defining aspects of my education was a program called prep school. I'm not sure you have the equivalent in the UK. It's like a 2-year intensive course in like a variety of subjects, like mathematics, philosophy, or languages. And basically, it prepares students to enter the best business school in the country. So then I joined, after those 2 years, a great business school. I started working in market finance, so nothing to do with healthcare. But I really knew very fast that it was not my thing. And it was, I think, during this time in market finance that the idea of entrepreneurship started to take root in my mind. Even if it was like just a feeling, I couldn't fully articulate why it seemed so compelling. But looking back now, I can't really recall exactly what I thought about entrepreneurship. It was just a vague feeling that not pursuing it would lead to regrets. I think that would be the main thing that would come out. And yeah, and entrepreneurship was one thing, and healthcare and the medical imaging world were another thing. And regarding my interest in healthcare, and then later to create AZMed, it felt like just a calling from the beginning. It might sound like very cliche, but every single member of my family, without any exception, like my parents, my siblings, cousins, aunts, uncles, like everyone, they are all doctors in some form. So radiologists, pediatric doctors, emergency physicians, dentists, like you name it. So yeah.
Nice, nice. No, that's really interesting, really, and I think it's quite nice how even though you didn't study, medicine, you're surrounded by people who did it, and I always feel like like if you grow up in a house of mechanical engineers, you end up knowing something about mechanical engineering if you don't study it because people are talking about it all the time around you. So I guess that gave you a good background to this, and it's quite fascinating that you decided to pursue that. And I'm really happy you did because now you're adding you got a product that which we're going to be talking about shortly, but that is adding a huge value to the market, and it's really fascinating to see that because I think it's a huge step for AI. I released I think one of the first episodes that I did on the podcast, an essay that I wrote by myself in terms of what AI means in to MedTech. It kind of covered briefly what the potentials of AI, and I'm just now sitting here, a few weeks later, listening to you talk, and you got this product that's on the market now and it's helping a lot of people. But then coming from that, would you want to talk about also like how you teamed up with Alexander and Dr. Ellie? Because I know it's like a little dream team there. You've got Alexander, who's the chief technology officer, Dr. Ely, who's the chief medical officer, of course, and you. So it's a combination of a healthcare person, sort of like the brains behind the AI algorithms, for people who don't really know much about the AI algorithms as to how it works, I just recommend you to episode 3 where I just talk the basics in terms of the definitions of what AI is. But Julian is free to also give us a short explanation, and then Julian. So like, how did you three meet, and how did you guys get together?
Yeah, so first of all, I think you're well informed, but that's definitely what you said. We were three at the beginning of this journey. Ellie, best friend since 15 years, and Alex, another best friend of mine. So it all started with Ellie. We were in 2017. He was and he still is a medical doctor, and he spent most of his time at the emergencies in Paris. And when you are a medical resident in Paris, you have to switch hospitals every 6 months in Paris. So you discover very quickly a lot of different ways of practicing.
Yes.
And I mean, in each hospital, he basically witnessed that a lot of fractures and other critical conditions were missed by well-respected doctors, very smart individuals, but it was due to just overwhelming workloads. You had like a huge discrepancy on the demand and the number of images that were being produced and the number of people actually able to assess it. And it's particularly true for X-rays. If you make an X-ray at any public hospital in Europe, you would be very, very lucky if your X-ray is directly analyzed by a radiologist which is specialized in the field that we are looking for. Most of the time, it's analyzed by a resident or by a clinician, an emergency doctor who is not a medical imaging specialist and who has like plenty of other things to do and who probably has dozens and dozens of patients in the waiting room. So it's basically really started like that. Eli joining his friends at night after his work at the hospital and just sharing how his day went. And on that particular day, he said, well, I'm surprised. I mean, I work with super smart people. I work with very renowned doctors that everybody in the medical field respect a lot, that I admire. But like we as a team are not enough to face the demand, and it can lead to mistakes. So everything that you hear on a daily basis about how the hospitals and our emergency room cannot face the demand, he lived it for the first time, basically. So that was really the trigger on that. And as you said, on the other side, you had Alex, the tech guy. He worked on algorithms back then to detect breast cancer detection on mammals, and also before that, he worked on cardiac MRI. So he knew how to build those algorithms, and he adapted this knowledge specifically for fracture detection. That was our very main focus. And then my job was more to evaluate the potential from this friend conversation and this scientific project, this algorithm, to then create a sustainable product and a viable company.
Nice.
So yeah, that 5 years later, here we are. So yeah.
Well, no, that's really impressive, really, because I feel like sometimes you like they say necessity is the mother of all invention, and sometimes you also need the right people around you, like the right group of minds just to get something started, and it seems like it worked out well. So right now, like how many people, how big is AZMed right now? Because I looked online, it doesn't really tell as to how many people work for you guys, but I'm sure it's grown quite a lot.
Yeah, so right now we are a 50 people company, and most importantly, we created 9 algorithms, which are spread and used across a bit more than 1,000 different locations, so hospitals, radiology centers, clinics, and in 40 countries, mainly in Europe, in America, like in the 5 continents, basically. So we we had the chance to find a real need in the market and to be able to scale the product really fast. Yeah.
Nice, nice. That's good. And then like that sort of like leads me to like my next question, because I know it has grown a lot and sometimes people might not really actually understand what we're talking about. But if I were to ask you like in a very short format, how would you say what is AI in radiography or in radiology? What does AI mean in this space?
That's a good question. It can mean a lot of things. Most of the time, when you talk about AI in radiology or X-rays, it means using computer vision or deep learning technologies to help any healthcare professionals reading a medical image to take the best out of the exam they are making. And taking the best means multiple things. It means first you can produce the best X-ray or medical imaging possible, meaning the cleanest possible with reduction of noises within the image. It ensures you that you have the best possible quality in the image. So AI can assess image quality in real time and flag the ones that may need to be retaken due to, I don't know, positioning errors or other issues. So that's even before you look at the image, having the best one possible. Then it can help you structure or optimize your workflow, optimize the way you diagnose a patient to treat them the best way possible. So it can sort, it can prioritize exams so that the radiologist focus first on the most urgent one or the abnormal exams first.
Nice.
Um, then obviously the thing you hear a lot is helping on clinical decision support. So it can detect, it can localize any abnormality on the exam. It can quantify, it can measure, it can characterize some lesions. It can compare it also with old ones or with previous exams to draw conclusions on the evolution of the lesion. And then, last but not least, it can also save you a lot of time and save radiologists a lot of time on writing the report. So once you analyze the image and you know what's within the image, it can also write you a report. And once the algorithm, it's exactly like the human brain. Once the algorithm has detected what's happening on the image, it turns it into a text, and the radiologist has to confirm it or to improve the report if needed. But he doesn't start from nothing, and he basically gains time.
Nice, nice. And just to add on to that, really, because, like I did biomedical engineering in university, and even though I've never really worked with X-rays, I spent a lot of time, studying about them, how they work and everything. There's been many attempts that have been done to help, radiologists be able to read these X-rays, and some of them include sort of like some chemicals or medication people take to increase certain resolutions of certain parts in your body to make them more visible. But just to add on as to what makes this technology quite special and quite exciting for me is because if I were to give you an example, it's like if you've got a bone that's like maybe this pen, for instance, it's like a long shaft. For some fractures that happen along the bone just like parallel to the bone, those fractures can be almost impossible for radiologists to read, because they're looking for a clean break or something. And sometimes you need something beyond the human eye to look at that and say, you know what, there's a fracture there. Because I know many people have been to the hospital saying, you know what, I think I fractured my bone somewhere, there's pain, and they go to the hospital and they get told, your x-ray is fine, just go back home. It's quite frustrating to be in that particular situation. And then this algorithm, this product you have is quite special in that sense. And then this brings me next to my point regarding Rayvolve, which is your product, which you basically selling right now, which you got the FDA approval, CE approval. And by CE, it means basically being approved for the European Union, for those people who don't know, and FDA is for the US market. Um, what could you tell us about Rayvolve as to what makes it your wonder kid at the moment?
Sure. Yeah. What I can tell you first is the example you describe is clearly one of the reasons why we started to do that. When you have like dozens and dozens of patients waiting and hundreds of exams to analyze in a very short amount of time, sometimes you can see it on the image, sometimes you cannot see the abnormality on the image. But in both cases, if you are in a rush, it's human to sometimes miss it. So what Rayvolve does basically is to detect the very large majority of the abnormalities you can see on an X-ray. So the two main pillars are that first, it can detect any trauma bone lesion on any part of the body. So any traumatic sign, whether it's a fracture or any other sign, it can detect it. It can detect it. And the second pillar is any lung or any cardiac abnormality that you can see on an X-ray. So what it will do is that first it sorts and it prioritizes the exam, as we said before. This is what we call triage. So the doctor can focus first on what matters and on the abnormal cases, because usually without the AI, the doctor can have work list with hundreds of patients, and they just read every X-ray without any optimization, and they don't know what they will look for. So AI can do this pre-work before, and then it detects, it localizes, it characterizes the abnormality. So once the radiologist opens the image, it doesn't show the image without anything, and the image where the radiologist has to look to every bone. It directly shows every finding of AI, so that they can gain time and quality. And finally, also, as we said, it can already write a report for the radiologist to validate it or to modify it if they want to add more things. So the ROIs for healthcare providers can be extremely diverse, depending on the
Yes.
country you are at, depending on the type of structure, the type of patient. You can compute the return on investment in multiple ways. But every time you can highlight the same two things if you want to summarize it. First, it increases quality of care one way or another. With AI, doctors are increasing their diagnosis ability. We've made a lot of study, but we've made a particular study to obtain FDA in the US with 21 university hospitals in
Wow.
Cleveland and in the region of Cleveland. And we compared the performances of 24 radiologists for the detection of fractures without our product first, and then with the help of Rayvolve for fracture detection. And on average, the 24 radiologists reduced their false negatives by 67%
Wow.
thanks to Rayvolve. So it means that if you miss 100 fractures without the AI, you now miss two-thirds less with the help of the software.
Wow.
So that's the first ROI that you can see a bit everywhere in different forms, but it's always coming back to that. And the second thing is that it's optimizing the workflow. It speed up the process. And that was also the case in this study. For example, we just computed the reading time, and in this study, they reduced the reading time by 27%.
Yes.
while increasing their diagnosing capability. They read images faster thanks to AI. So that's the two main ROI that you will be able to see.
Well, that's really amazing. Really, I think it brings me back to the idea of like machines can work without getting tired, without needing a coffee break or a cigarette break, and all of that comes into hand. And when we're working in these high paced environments, because even in the NHS, for instance, in the UK, there's a lot of long shifts, a lot of hours, and people feel like they're being overworked because the healthcare systems they're quite overwhelmed, they're flooded, and sometimes all these decisions, whether it's making one part efficient, it eventually adds on to making the system better overall, because by making it faster, it means probably less people have to stay in hospital. It probably means that you don't get the wrong diagnostic. You don't have to go there several times to the hospital before you get something. And all this adds up in a huge system. And it makes me wonder now as to just a quick question with your algorithm, because AI algorithms get better with more information. Would you say that Revolve is getting better every day as the data set it's learning from gets bigger and bigger?
Definitely. It may not be an improvement as what you have in mind if you don't know about AI, meaning it's not live, it does not learn every image it analyzes.
Okay.
But what we do basically is, yes, we gather images from all around the world. We have more than 20 million images in our database now, coming from more than 40 countries. The key is to have diversity in the images, to have
Wow.
any kind of radiological structures, any kind of patients, any kind of abnormality, to have the most representative database possible.
Yes.
And then what you do, you cannot use it live and train your model live on the images it
Yes.
produced, because yeah, because it's as it's medical data, it's a bit sensitive, and if you take two radiologists, you make them analyze a single image, sometimes they will have different diagnoses, you know. So what we want to do to have the cleanest indication possible to train the algorithm on the best source possible of data is that we have internal radiologists looking at the same images. So we have at least three radiologists per case to be
Nice.
sure that we take the ground truth on that. And then we feed the algorithm with that. So yes, it gets better obviously over time, and it's huge to see the progress it can make. It's really impressive, but it's not like it's not growing every day as soon as it reads an images.
Okay.
It's but yes, definitely it progress.
Nice. And to be honest, I like that approach. I think it's better that approach because you're not just letting it run wild with information that's coming. You're feeding it information that's been confirmed by the three radiologists and that form part of AZMed right now. And yeah, that's actually better than running it live, because you don't want it to get the wrong information to learn from. Otherwise, it becomes a problem to try to unteach it something wrong it has learned. And that's the beauty of what the capabilities of this technology means for medtech. And it then, like, I know you already mentioned that now you guys are available in 40 countries, and you got FDA approval, you got CE marking. But I'm sure the question for people listening right now who don't have this Rayvolve from AZMed is, how much does it cost, Julian? Like, how do you guys factor in the cost for people? Is it an expensive piece of software? Is it like a subscription fee, like Netflix? How do people pay for this particular software?
Yeah, that's a good question. So those softwares, what we do and what you can see on the market, more generally speaking, right now is it's most of the time a subscription fee, whether it's monthly, annual, or pluri-annual fee. It depends most of the time on the number of exams produced by a certain structure. But it's like a subscription fee, and it's a fixed fee, and it's always the same. And it's very hard at the beginning for healthcare institution to know the right price and to know if it worth it. That's the main the main challenge for AI companies right now. So what we do is we tell them to try it first. We can have all the clinical studies in the world. They have to try and to know it's best for their structures. So we spent a lot of time and we reinvest a lot of resources on our own to be able to not only to install an AI product and then to let them do on their own. We really are on every step of the process with them, and we are every way with them, and we are being sure that they have a real return on investment, and that they can, at the end of the trial, justify the price.
Nice, nice. That's really good, and I think it's a good business model, especially for a new technology, because essentially what you're doing, you're teaching the markets about your product, since it's so innovative and something brand new to the market that some people don't even think about it. So first, you have to sort of like educate the market about letting them know what you have, and then you have taken the approach of the subscription fee depending on the usage they're having, etc. So then I guess then you have customer support, because I'm sure for some people AI is still a big word. They're probably worried about the technology. Like how are you supporting people in different markets? Do you have people speaking different languages, different procedures, manual guides? Like how are you guys tackling that sort of like fear of AI essentially? Because I know some healthcare hospitals can be quite conservative in terms of what technology they bring. So how are you guys overcoming that fear, essentially?
That's a good question, and
Yeah.
that's a good question also because I think now, specifically in the medical imaging space, it shifted and it's not fear anymore. 3, 4 years ago, it could be fear to say, okay, maybe we will be replaced. Now it's not the case at all. Like for radiologists today, no one is fearing about being replaced or not to control this type of technologies. So that's one first good point, because the market is evolving. And then to be able to prove the value and to be sure that they can, because once you enter a new hospital to install your AI, it's the first time they use AI on medical imaging. So it's brand new. It will become a standard for them, but you need to make that happen. So it involves many teams in the company to be able that it becomes a success. Obviously, you have customer support to be sure that the product is, first of all, known by everyone, that every doctor in the hospital has been trained on AI. The more you know how it works, the better you will use it, and you will know when to use it and when you don't want to rely on it. So that's extremely important. Then you have medical teams also that speak the language, the languages of the countries, to be able to assess the medical ROI. And then you have the tech teams, you have the ops, you have the dev teams, to ensure that the product is working well all the time on every images, that you have a turnaround time below 1 minute, to be sure that once the image is produced, AI is working in less than a minute on the results, so that once the radiologist opens the image, you already have the exam and they don't wait. That's the basis, but it should happen every time on every image. So you have all those teams on the company, which are gathered together to make it a success. On average, you have a 90% conversion rate between a trial and then a real long-term partnership. So
Nice,
it works, and really radiologists understand once they try it that it's like they can't get rid of it, and it's our job to make that the smoothest possible and to invest whatever it takes to let that happen. So yeah, it's
nice.
definitely one of the key thing in our market, in our company.
True. And just to add on there, just to give people more confidence who are listening to this for the first time, like how many people do you roughly know does, because I know you said you got 20 million scans, but do you know how many people use the software, or how many patients does the software look at? Let's say whether it's per month or per day, worldwide across all 40 countries. Do you have a rough idea of how many people are using it?
Yeah, right now you have 4 million patients which
Wow.
are analyzed by the software per year, and obviously it's growing every month. It's growing, but it's a good milestone. Yeah, I think 4 million patients worldwide. It's something that we would never imagine from
Of
day
course.
one, and yeah, and that's also very it's a good entry point to do it first on X-rays, because
Yes.
it's like the first exam that everyone is making once you go to the emergency. Most of the time, if you have like any pain of any kind, like the most prescribed exam is X-ray before doing anything else. So it allowed us to enter a lot of different hospitals very fast and to have an impact very fast on the most patients possible.
Nice. That's really outstanding. And I know I just did a quick search right now. Like 4 million people. That's more than the population of Paris. So it's like everyone in Paris
Yeah.
essentially using it. So I think that's a huge confidence boost for people listening to this right now. Like it's like 4 million people using it. And talking about extending the market. Would you like to tell us about your partnership you did with SimonMed? Because I know SimonMed, they're based in the US, Scottsdale, Arizona, and they chose you guys. I think was it last year in December. So there's like fresh news. It's like less than 2 months old, to be sort of like their partner in terms of when it comes to looking at X-rays. Like, what does that partnership mean for you guys going forward?
Sure, yeah. So SimonMed is a huge radiology group in the US. It's one of the largest outpatient radiology group in the United States. They own more than 200 centers across the country. And they decided to use Rayvolve a long time ago now, maybe 18 months ago, to speed up their turnaround time. So the turnaround time is the time between the acquisition of the X-ray and the moment the result is communicated to the patient. So
Wow.
they assessed what they did basically is they assessed it. So they assessed the turnaround time during the first semester of 2022 without any AI, without Revolve. And they did the same thing. They did the same assessment during the first semester of 2023, so exact same period, with the help of Revolve. So the study was done in total on more than 300K images. It was a huge study. And the main thing they showed was that the turnaround time was divided by 8 for positive fracture cases with AI. So for them, it's clearly a game changer. It changes everything in terms of patient care, in terms of how they would treat and follow the patient, how they can warn the patient once they are still in the room in the radiology center. They don't have to wait days to tell them and to recall them. They can make an additional exam right on the spot. It changes everything in terms of patient care, and that's exactly what we want to promote and what we want to how we want to change workflow and our healthcare institutions.
Nice, nice. And that's good because to me, this sounds like more market leverage for you guys. And essentially, this is good for patients at the end of the day because it's like you're getting more people pushing the same message. Get the echo gets louder and louder. And that's good. That's good stuff. And I'm excited to hear that. And I don't know if you have any other partnerships that are in the pipeline. Maybe you can't tell us yet, but I'm sure with this technology and everything, it's going to be growing a lot more now, especially with this partnership. And I think we only start to see the results in the next coming months since it's still so new. But just looking at that, do you think that also the partnerships you've done, maybe with with some hospitals, whether it's in France or across the other countries, let's say the one you did, particularly in Cleveland, do you think that also has also helped? Like Rayvolve, like getting much bigger or getting out there to the patients. Just out of curiosity.
Definitely. If you start something in the medical space,
Mm.
and if you have like good advocates which are using your product and can tell and can tell you how much it bring you in terms of efficiency, in terms of quality or anything, definitely it helps a lot. It doesn't like you will not be able to make sales or to be able to go through the market directly with that, but it gives you credibility and it's
Yes.
key in this market. I think
Nice.
the best marketing you can do is publishing papers, strong papers with partners that have used your product and that has and your if your product has a significant impact on their workflow and it concerns also other peers, then you're really likely to be successful. So anything that we can do in this space and any proof that we can gather is clearly one step further for us to gain confidence, to gain credibility, and to show that we can really change the way patients are diagnosed. We can change the way radiologists are reading medical image, and I think that's happening. I think we are in
Nice.
really good path to do that. So we need to keep going, but it's really really interesting to see how the this market, how AI is changing radiology and how
Well,
it's completely revolutionizing the way medical imaging are being processed. Really,
well,
that's really impressive.
nice. That's really impressive to hear as well for me, because talking about going out there and doing more things, I also understand that you guys are also going to be attending the there's a conference happening this month, and just for people listening, this is February 2024, from the 28th of February until the 2nd of March. I understand you guys are going to have a booth at the ECR,
ECR.
which is basically part of the European Society of Radiology. So for those 3 days or 4 days or 5 days, I think I keep getting confused with February because it's a leap year. So it's a leap year today. So there's this year there's 29 days in February. So from the 28th, 29th, 1st, and 2nd of March, you guys are gonna be in Vienna, and like, what does that mean for you guys, now being sort of like being given this platform to speak to more radiologists and etc.? What does this mean for you guys attending this
It's very simple. Every single radiologist who comes to ECR, so to the European Congress of Radiology, either they will use AI for X-rays very soon, or they already are using. So this is like a fact. This is happening. Like AI is becoming a standard of care, and AI for X-rays, whether it's for MSK X-rays, chest X-rays, is one of the main use case.
yes.
So our goal at ECR is to help them integrate AI the best way possible. Our goal is to make them and to help them make the right choice, to guide them through this change, and to be the right partner for them.
Nice. And I think it's also quite good because for people listening right now, if they're gonna be there, I think this is a good question. It's a good chance to meet guys from AZMed in person, get to see what they have. Because I'm sure at the booth they're gonna have a few examples of how the software is working. So it will be a huge interaction. It's unfortunate that I won't be able to attend it, but if I could, I would have loved to be there just to see what the software actually looks like, and get to see how the people are in person. And
And
yeah,
actually, we have a couple of congresses in the UK,
nice.
so we do it too. Yeah, we do it a couple of times in the year, so you have to come. Really.
Yes, I will. I will. If it's in the UK, I'll try to come. It'll be easier for me to do that. But then sort of like looking at the time, I know like you're busy and stuff, so I'm just gonna start asking you the last few round of questions. But I know just in general for people listening to you for the first time to know the more personal side of Julian. What would you say makes it interesting for you to work in medtech? Because as you said, you could have stayed in finance. I'm sure, like most of my friends who went to finance, they tell me about the bonuses they get every month, every year, and it's a lot more financially rewarding and everything. But you chose to come to medtech, so what exactly makes it interesting for you to work in medtech?
Yeah, it's a really really vast subject. First of all, the first thing that comes to my mind is that you work with really smart people. You work with AI researchers, with doctors, with like every interaction you have are usually with smart people that know what they are doing. So that's really challenging, and it gets you better. It makes you better, and I think like the main thing it's extremely satisfying to help a doctor, in this case like a radiologist, on its core expertise. That's the main
Wow.
thing for me. Like when a radiologist with 30 years of experience tells you, thank you for what you do, you helped me save a patient, you helped me deal with the 100 cases I had to review in 30 minutes. Like when someone tells you that, I can tell you it's the best feeling in the world. I mean, you help a doctor on where they are the best at. Like you help them on where they focused their last 30 professional years. And it's not like you help them on their admin task. And don't get me wrong, like I have nothing against those companies. It's the opposite. Like they are great companies and they can become huge companies, but here you have an impact on their core medical expertise. So that's, I think, extremely powerful. And yeah, and more generally, when you innovate in medtech, there's something telling you I am at the right place. Even if you don't really know if what you do will work, even if you have doubts or whatever, at the end of the day, you can tell yourself, okay, all those efforts, all those sacrifices, at least they would be done for the good. So here you don't have the problem to find a meaning, like a sense of what you do. I think that may be a common point of a lot of people for our generation specifically. So I think that that's the main thing. And if I can think of one more, maybe also it's a regulated market. And as all regulated markets, what's interesting is that you have huge barriers to enter, and you have to obtain multiple certifications in our place. So when you want to change something on the product, it's not just you that would change the product, and you change, you test, and if it works, that's done. I mean, the slightest change would require a full team to change all of your documentation and possibly to certify again your product. So it would be very complex. So as any particularity on any market, you have to be aware of it and you have to turn it into a strength. So here, the strength that you can have is that first, it forces you to have a vision. You cannot just go step by step without thinking big, thinking about the big picture, which is often a mistake, I think, made by a lot of startups. You have to think bigger from day one because you know any change throughout the process would have an impact on your whole product. And second, you are way more structured and you have way more processes than any SaaS B2B startup in any other field. So if you can turn that into an advantage, you would be in this case able to scale way quicker because you would have all those processes, all this traceability, and all this structure from day one, because it would have been required by the regulatory bodies or the CE marked or FDA or whatever.
Yeah, nice, nice. That's a really good answer. And you know, one thing that you mentioned there, I think that's quite common with everyone who works in this industry is just the amount of patients like you reach out to. It's like every time you work in medtech and you do R&D, chances are you're creating some new technology for the first time that has not been really seen by other people. So it's like you see how it's impacting people like in real time, and it's kind of rewarding in that sense. But yeah, just to ask you now in terms of like your thoughts on the future, and this is just a general question from what you've seen. What do you think the future holds for us in terms of like like how's AI gonna be coming along, or in general, like what's your take on that?
Very difficult question.
Yeah.
One thing I can tell you is that AI will become a standard. It means in healthcare and in medical imaging, it means it will be everywhere and it will be transparent for me. Like it's not AI is not a product by itself. It's you really have to see it like an engine within a car. It's one component of a whole product. So okay, it's like it may be the core of the product, but it will be fully transparent, and you will talk about AI how you talk about computers today. It's just a mean, it's just a technology to help you achieve something, not more, not less. That's all. So I think we are getting to that point. And if you go deeper into medical imaging, I think it is it's completely revolutionized. AI is a game changer for radiology specifically. We talked about it just before, but the way they would have a look at images, and they would now be able to be way more efficient, focus on where they are the best at, on where they can bring value, would have nothing to do with how they diagnose a patient today. So I think if you're a medical student and you have to choose what you want to do, and if you like technologies, and if you like to use technologies and to adapt to that, it's a fantastic space to be in, because you would be at the forefront of how technologies and AI would be put in service of healthcare, basically.
Nice, nice. Now that's really good, and that's deep. And as you're talking, I'm just going to take this chance to ask you a few questions. In terms of the future of like AZMed, because right now, from what I understand, you guys have Rayvolve, which is particularly focused on bones, right? But then, do you have something in mind coming up for soft tissue? Because for people listening out there, you can also use X-ray, or the technology is still the same for looking at organs, like soft tissue. I know that's going to be a little bit more complex, but do you guys have something in the pipeline looking at soft tissue?
Yes, yes, we do. What we wanted to do first is to take the most common type of medical imaging that you could do, X-rays, to take the main needs from the radiologist and to tackle it one by one. That's what we did, more or less. Now the goal is to do exactly the same thing on other type of medical imaging, and to take the
Nice.
main radiologist needs where they would need the most AI. Sometimes it doesn't mean it's the most difficult abnormalities to find on the image. It just means they need it the most for any reason it could be. And the goal would be to tackle it and to represent their main partner in terms of AI, so that they would have their main partner to help them whatever they need it from, and to be able to keep for them what they want also.
Nice, nice. Now that's really good. I'm really happy to hear that there's something coming in the pipeline for other sort of X-rays that that are used out there. And yeah, and just the very last question, Julian, for people listening right now, in terms of your business journey over the last 5 years, like what words of advice would you give? Would you say take it one step at a time, as you've been mentioning repeatedly, or would you say other things?
Yeah.
Because I've been taking notes of some of the good things you've been saying. I always do that with every CEO that comes on the podcast. I always take the opportunity to take something like a word of advice, and I've been adding all the things I've been learning from different people, like in
Okay,
my
nice.
notebook. So, what would you tell people listening is one word of advice from Julien Vidal? What would you say?
I mean, if you want to start something in the healthcare space, the best advice I think I can give you based on my experience is don't think too much about how it's being done currently, and genuinely and almost naively look at what you think would be the best way to change a certain thing that you would want to spend the next 5 or 10 years. Because those markets, such as healthcare, they are so much driven by old habits, and by habits that don't make any sense now. That if you want to create something and to truly innovate, you have to come with a fresh eye. You have to come with a new eye that would be almost naively convinced that you can change it, when everyone is telling you that they are just used to do it one way and they don't have any reason to do it another way. So yeah, my best advice is listen to yourself truly, and don't at the beginning. It's a bit. I think companies would succeed like that, but my advice would be don't gather yourself, and don't recruit people from the industry first. if you want to really create something big and not just to create something that will last not for a long time. Surround yourself by people that know how to look at the market with a fresh eye and to have truly innovative ideas. So that would be my advice.
Well, thank you very much. And yeah, that's it for this episode, Julian. I really appreciate the time you've taken to come on the podcast. I'm going to be adding, links below, some videos on this podcast. So if those people are listening to this on audio, if you want to go on the YouTube channel, there'll be more visuals from AZMed to see what it's like and everything that they have. But and I'll be adding your contact details. I think I know I saw your LinkedIn, Julian. I'll just put the link below as well, and other contact information that people might who are interested can just look at and read more information. But there's plenty of articles I've read. So yeah, thank you very much for coming on the podcast today.
Thank you, Rodney. Thank you very much.